Hi, my name is Cindy Tupper. I'm a public health school nurse in Estrie. In order to help you prepare for your school vaccination clinic, which will be held in the upcoming weeks, let's go over some essential information together. That is to say, the diseases for which you will be inoculated, the side effects, the procedure, and the instructions to follow. We want you to be able to express your free and enlightened consent. Once you turn 14, you are old enough to consent to your own health care, including vaccination. Even though the decision is yours, we invite you to discuss with your parents. They will soon receive a letter from your school that includes the information presented in this video. Ever since you were a child, you've been receiving vaccines. During your school vaccination clinic, you will be offered vaccines based on your age, your prior vaccinations, and the existing provincial vaccination calendar determined by the Ministère de la Santé et des Services Sociaux. In secondary 3, the main vaccines are those that provide immunization against diphtheria, tetanus, meningitis, and HPV. These are mainly booster shots of vaccines you've received when you were younger. We are administering them again to boost and optimize the antibodies and obtain a better protection. If you need other vaccines to complete your immunization, the nurse will speak to you on that day and offer you to get those shots. Let's take a closer look at the diseases that the vaccines will protect you against. Diphtheria. Diphtheria is a bacterial infection that is transmitted through nasal or throat secretions, saliva, mucus, or spit, or through skin lesions. Diphtheria can cause serious sore throat, high fever, and respiratory problems. In certain cases, diphtheria can lead to complications such as heart problems, cranial nerve paralysis, and even death in 5 to 10% of cases. Tetanus. Tetanus is also a bacterial infection that is transmitted through an injury from a contaminated object or an animal bite. Once contracted, tetanus causes muscle spasms of the jaw, the vocal cords, as well as muscle spasms throughout the body. The infection can lead to complications such as respiratory problems, heart problems, and in 10 to 20% of cases, death. Meningitis. Meningitis is a bacterial infection that is transmitted through nasal and throat secretions, mucus or saliva. Once contracted, meningitis can cause high fever, severe headache, nausea, vomiting, a general feeling of illness, rashes, and pinpoint hemorrhaging or blue spots on the skin. Some patients might experience severe complications, including permanent brain damage, amputation of hands or feet, 10 to 15% of cases, and death, 10 to 15% of cases. Human papillomaviruses, HPV, are viral infections transmitted through skin-to-skin contact during a sexual act, even if there's no penetration. Even though carriers are often asymptomatic, HPV can cause precancerous lesions or genital warts, better known as condyloma. Possible complications include cervical, anal, genital, throat, or mouth cancer, and in rare instances, death. In Quebec, approximately 70 people die each year as a result of HPV. Vaccination is the most effective means to protect you from diseases. Vaccination efficacy is proven to be above 90%. A vaccine dose is injected in the arm muscle, more specifically the deltoid. One injection represents one vaccine. During your school vaccination, you should normally have 2 to 3 injections. The syringe needle is short and fine. There are 2 instances in which vaccination is not recommended. First, if you're pregnant. Some vaccines are not recommended for pregnant women, so in that case, a nurse's evaluation would be required. Secondly, if you have a severe allergy to a vaccine. By severe allergy, which is quite rare, we mean respiratory difficulties that resulted in your hospitalization. You normally should know whether you had a strong reaction to prior vaccine because you probably received an initial dose when you were younger. That is why it is so important to discuss it with your parents so that they can inform you of your reaction. While most people tolerate vaccination, some experience side effects. If so, it would probably involve some pain, a rash, or a swelling at the injection site. To minimize these side effects, move your arm after the injection and apply a cold compress. You might also have a fever or a headache. If that is the case, take acetaminophen which is Tylenol, or ibuprofen, which is Advil. In rare cases, a severe allergic reaction can occur. In order to confirm that your body is reacting well, we ask you to remain in the designated room for at least 15 minutes after vaccination. On the day of school vaccination, you will need to complete a questionnaire. Remember to bring your pen. The nurse will go over the questionnaire with you and will indicate which vaccines are recommended for you. Depending on your immunization profile, you might not receive all the vaccines presented in this video. We will administer the vaccines required and give you the corresponding information sheets. You will wait 15 minutes in the designated area, and you will then be able to resume your normal activities. To find out when the vaccination clinic will be held, read the documents that your school will send you. Let's conclude with the essential points. Before vaccination day, ask your parents if you've ever had chickenpox. If so, how old were you? If you are under 14, in order to get your vaccines, your parents need to sign a consent form. You will be given the consent form a few days before the vaccination clinic. Eat properly and get some sleep. On the day of vaccination, bring a pen and your vaccination booklet. If for any reasons you do not have your vaccination booklet, the nurse will give you a sheet that you can insert in your booklet once you have it. Wear a short-sleeved shirt and bring a snack. If you have any questions, please feel free to ask. Visit the website of the Ministère de la Santé et des Services Sociaux du Québec at quebec.ca. Speak to your parents about vaccination. Call the school nurse at the number provided in the letter that the school will send your parents. Or call an Info Santé nurse by dialing 811, press 1. Thank you for your attention. May your vaccination experience be a positive one.